Currently, there are 42 new cases of COVID-19, and these have been confirmed globally from the 31st of December 2022 to the 13th of January 2023. So far, Nigeria has recorded 266,492 COVID-19 confirmed cases, 3,155 deaths, and 259,858 cases have been discharged across 36 states and the Federal Capital Territory. We're joined this morning by virologist Dr. Oladipo Kolawole, who will be joining us to explore this conversation even further. Thank you very much for joining us.
Yeah, thank you for having me this morning.
It doesn't look good for us. I mean, it's uncomfortable news to see that we're back again to the wearing of face mask era. So talk to us about this. There have been conversations about the new Omicron variant, the new mutation of that virus, which is the XBB.1.5. And here we are again, back to wearing face masks.
Yeah, let me just give us a background. Like 2 years ago, I wrote in Punch that we should expect more variants, and that is expected. There is something that we call survival of the fittest. Every organism wants to survive. So as much as we are trying to break their powers, trying to make sure that we conquer them, they also will be looking for a means by which they will escape various mechanisms that we put in place. That is one. Two, the virus we are dealing with is RNA virus, and RNA viruses are prone to mutation. And the mutation could be in two phases. It's either to be the advantage side of the virus and disadvantage of human population or the host, or the other way around, disadvantage to the virus and advantage of the host. So, but the case we are seeing now, we are seeing Omicron mutating, and it has been labeled at XBB.1.5, though we don't know why. It was labeled that, not like Omicron, Delta, Alpha, all the stuff, not using the Greek name. But the most important feature of this virus is that it's highly transmissible. So the transmission rate is higher than the variant that we have, although the disease is not as severe as others, but highly transmissible. And the challenge we have with people that are not vaccinated and individuals that have underlying health problem. Another critical case about this variant is that it doesn't really show clinical symptoms like you quickly see. So by the time that you'll be seeing the clinical signs, at least some havoc has been done in the body system. And that is what we need to know. Major factor that is contributing to this is that this virus is highly transmissible. It means its transmission rate is very, very high. And currently now is displaying the previous variant that we have. If care is not taken, if measures are not in place in the few couple of months or weeks, it might be the dominant variant that we have in the population.
Doctor, I want to talk about because now the WHO is mentioning the use of face masks once again. So I want to talk about the virus fatigue that may have gone across the continent, across Nigeria, and across the world. So kind of share a little bit about that, and then also there is, and let's start with that, and then I'll bring you in on the second one.
Okay, the virus fatigue is setting. Don't forget that we are.
All right.
We seem to have lost
yes.
Dr. Kolawole there.
So there are many angles to this. Yes, indeed, there is.
Once we experience, you're going to after a while that we experience this thing, we all feel that we are okay, we are good to go. So we tend to neglect what we are doing in order to have us prevented from the virus. So it is natural for human beings to have that sense. Now, it is now left for different agencies, different government, different organizations to keep reminding us that this thing is not still, it hasn't gone, it's still with us. So the fatigue is normal, and people don't like doing something that will inconvenience them, like we were chatting. yeah, it's something that I don't want to do. I'm not convenient with it. So once there is no talk about it, everybody go back to the old normal, which is very deleterious to each one of us.
Man, you know what? Now that we talk about the virus fatigue, one wonders how easy it would be to then say to people that they should go back to wearing face masks. But let's talk about some of the things we may have done wrong. It was inevitable for this mutation to occur, as it is with a lot of viruses. Like you said, the survival of the fittest, and they would invent ways to find a way to outlast or outlive their host. Let's talk about some of the things we may have done wrong, especially as regards December. We saw that there was a large influx, a lot of people traveling. Do you think that maybe we shouldn't have stopped with the face mask wearing? What are some of the things you think we should have done differently to prevent it from, getting to the point where we are going out and then coming back again to wearing a face mask?
I think the first thing that we did wrongly is we reduced our emphasis on vaccination. And it is not the best. When it started, we were encouraging people to get vaccinated. And now you hardly see people talking about being vaccinated again. And the more we get vaccinated, the more we have the herd immunity in our community, where it's going to protect us against emerging variants. Even peradventure, assuming, quote and unquote, if the vaccine is not as effective on the new emerging variant, there'll be a high level of protection in the community. We let down our guard. We never talk about it. We never speak about it. It's only for those who are traveling. I've been traveling out now that if you are vaccinated, fine. Then we have reduced surveillance. No one is surveilling for anything. Most of the reports that you see is either because somebody is traveling out. If you look at some other developed country, they have an effective surveillance system in place. Either you have the symptoms or not, there is a way the surveillance system picks someone that is highly infected. Then three, like we already said, look at the principle of hand washing. Get to all public places now. Hardly do you see that again. Because we thought we have overcome it, then we should not do anything. We need to go back to that. Then last year, December, like you said, we have a lot of inbound flights from various countries or various continents. There was no emphasis. Even if you travel now, it's not compulsory for you to use face masks. But I feel that should be encouraged. And if you see the flight attendants, they are always on face masks. But passengers are not on fixed masks. So I think our airlines should also come back to this effect. At least if you're on red zones and flying in and out in different parts of the country is one of the reasons where this virus can easily be picked up. So we need to emphasize on these, and our government needs to rise up to that, and look at NCDC too. For now, you don't need to fill any inbound form online. But some of those things are actually needed this time of the day. It shows that, oh, have you had the symptoms? You feel it before you take your flight. It's not that you should be screened once you have been vaccinated, but if you have not been vaccinated, there should be a way we put a rapid detection kit in our airports in order to screen people if actually they have the virus or not, because not everyone that have the virus show the symptoms. And even those who are filling the form, are they truthful with the form they are filling? Have you had headache? Have you had this in the past few days? Everybody could say no. And because people are not sincere, even those who are medical personnel know that even some patients come to you, they are not sincere. You ask them, when last have you started having headache? You say, I just started having this morning, whereas it was 2 days ago. So all those things we were doing before, encouraging wearing of face masks for people that are immunocompromised, people that have underlying health problems, should be encouraged. We need more sensitization on our radio, on our TV, to let people know that this virus is still with us. In regard of Nigeria, we can't know the actual figure because the surveillance we are doing is limited.
Dr. Kolawole, I understand, where it is necessary, to continue to spread the information. In the parts where we fail to continue to vaccinate, people and all of that, how we need to remind people of healthier living habits like, hand washing and all of that. But I'm sure you might have also noticed that there is a growing level of distrust with the whole narrative concerning COVID across the world, there's more and more people starting to ask more questions with regards to the whole COVID story. And so it might be a little harder now to convince people to even get vaccinated. There's more people that I've spoken to lately that say they regret even taking the vaccine because there's just so much of, stories that just don't add up anymore if you've followed international media and the likes. But another thing I want to ask you as a virologist is, now we're talking about a new strain, XBB 1.5, I believe. Viruses, these new strains, I would imagine that, for Africa, the virus will mutate into a form that fits, the continent here and what it dealt with here. Different from what it will mutate into in like Australia. So can you help us understand why every 4 market days we have a new strain spring up somewhere, and it's this same strain that goes across the whole world? It's not like, every continent doesn't have like its own specific mutation.
Now, what I can say in this regard is you have information of the variant based on how strong the genomic epidemiology of that country is. The countries that are reporting have a system in place in which most of the African countries do not have. I will tell you that South Africa is doing well. Yeah, they're doing great. You can see the last time they reported the strain that they discovered in their own country. The question is, the health system in Africa, it is not strong enough to do early detection of variants that are circulating. You see, by the time they discover a variant circulating over there, that is the time that we keep rushing up and down here. The question is, what are we detecting? And it may be a surprise to us that within our own continent, there could be some other variant that we have not reported or that has not been detected until we have a major genomic epidemiology surveillance in place. And I can tell you, yeah, there could be that in a particular region, there could be a dominant variant there. It occurs. It can occur. No doubt about that. But unless our genomic epidemiology surveillance is good, we keep working according to the dictate of the Western world.
All right.
That is just my own submission.
Thank you very much, Dr. Oladipo Kolawole, for joining us. We hope that things don't get out of hand, and this is our reminder to everyone who's watching, to you who's watching, to please get your face mask as you step out to protect yourself and your loved ones. Dr. Kolawole, do enjoy the rest of your day.
Thank you for having me. Thank you.